is even better than that. Called MagMind is the product that I've seen. So these are some research backing up the OCD with TBI. We all know, as far as brain injury goes, sometimes it's clear someone's had a brain injury. But we also know that there are many cases of mild TBI, and if you or a loved one has mild TBI, there's nothing mild about it, is there? So 44% of patients with alcoholism and drug abuse have actually had a brain injury. 58% of homeless men and 42% of homeless women have had a brain injury. Depression, anxiety, and suicide are related to brain injury. But how would you know? How would you know unless you looked? How would we know unless we looked that these patients have had a brain injury? Remember, it's 99% effect, more sensitive than MRI or CT. It's going to get missed. This is why the NFL has taken so long, because they didn't want to look. I was talking with the attorney earlier. The NFL does not want to look at the problem because they're going to have to pay a huge amount of money. We're going to change the game. It does need to be changed. These players are struggling. At the Amen Clinics, we're passionate about NFL and football in general and how it's affected these players' brains. Junior Seau, Jovan Belcher, these are players, one was retired, one was active, and they took their own lives. Tony Dorsett has been in the media recently as saying that he has struggled with depression and suicidal thinking. His kids are afraid of him. He's got rage problems, and he's got memory problems. He's driving them to their sports practice, and he'll forget where he's going. He's really struggling. So we did a study, so we scanned players' brains to assess them, to help assess them. So here on the left is a healthy scan. On the right, 16 years of playing football. Can you see the difference between the two? Swiss cheese. Now, they look like holes. They're not actually holes. That's an important point. But there are decreases in activity, decreased levels of activity in those areas of the brain. So we did a study. Yes? Yes, that's right. The question is, have you controlled for normal aging? So this, yes, our brain, as we age, there's going to be some, unfortunately, some shrinking, some decreased activity overall. However, that brings up a point of a concept called brain reserve. That the concept of brain reserve is that you start with a healthy brain, and then based on what you do, you can either improve or decrease the health of your brain. Playing football decreases the health of your brain. Drinking alcohol, eating an unhealthy diet, not learning or not thinking, not getting enough sleep, these all hurt the brain. Say again? I said undoubtedly. Undoubtedly, right. When you think about who gets brain injury, who has symptoms related to brain injury, that's a very interesting concept to me, because two patients come in, one, for example, they've both been in a tank, soldiers in a tank. They get hit by the same missile, and they get damage to their brain in the same velocity and everything. But why does one have a headache for a couple days and then they recover, versus the other has chronic irritability, anger, depression, mood problems? Well, I think it's brain reserve. So maybe the player or the soldier who recovered lived a healthier lifestyle. They had better relationships. They ate well, they slept. Maybe the soldier who didn't recover had a history of alcohol use or depression, or had previous injury to his brain. So I think the concept of brain reserve is very relevant as it turns out with brain injury. So back to football. Oh, question.
Is there going to be any legislation or consequences legislated for coaches who put them in? I was a team mom for many years, and I was the helmet happy mom, and they just neck collar and checking out the
Yeah.
because I had two sons who played, and I also taught the concussion classes for them, and they didn't come in, they didn't get to coach, so it was very motivating because I wanted to coach. But
Yeah.
is there going to be any revamping of that?
With more moms like you, I think that.
Well, I mean, yeah,
Concussion protocol.
but
Concussion
function.
protocols that are in, and the coaches, if you're a coach either in a school or if you're a coach in like league sports, and you have to go through training, and then if you put a kid back in, you can be liable.
Okay, so
So like
the
there's a
liability
return,
falls on the
there's
insurance.
like a return to play protocol. It's like, yeah, there's.
But
in Oregon.
I just think we should coach again personally.
Well, I have two cousins that play professional football. They already has been compensated because of injuries.
Because of injuries, they've been compensated, yeah. There's a whole movement, and Zachary Lystedt law is now in all 50 states. You're familiar with the Zachary Lystedt law, which is that players can't be sent in after they're suspected of having concussion.
They do, all the time.
They do all the
I
time.
yanked his senior out one year, man, I thought he was going to kill me.
Wow,
He was so mad, and his dad wanted him to play.
so
And
much
so
pressure.
funny, and the coach was mad.
Mm.
That was when Tim was playing, yes.
Yeah, the players are never going to ask to be taken out.
But what was ironic to me was the team doc was in the stands, saw this kid get hit, came in and assessed him, and was going to let him go back, and he put in the stands.
Oh my goodness.
Send him in.
Yeah.
Sorry, no, we're calling an ambulance.
Yeah.
And so it's terrible.
It's terrible, isn't it? Yeah, with football.
The NFL is nonprofit.
Well, they
Yeah.
have to take the testing and pass it, and,
Hmm.
and
There needs to be more more
training.
intense training. Absolutely, yeah, without a
the
doubt.
lifelong damages that it causes is unbelievable.
It's true. Question in the back.
Do you know of any research being done regarding helmets? There's a lot, all these players in the NFL and in little younger, they're all wearing helmets, but it
Yeah.
doesn't preclude brain damage because
Yeah.
the brain is still shaken. So do you know of any research? I've heard of gels, all sorts of ideas, but I don't know if there's anything being done.
I know they're doing research as far as putting little sensors in helmets to measure velocity of hits and accumulated hits, and that I think there's talk of pulling them after a certain amount because they're, hits, even subconcussive hits to the brain are cumulative over time.
But that's all
But-
just measuring after something's occurred. My question is a different methodology for actually creating the helmets that would preclude some of the injuries that are occurring.
Yeah, I mean, just even with I think the best helmet, hitting heads, our brains weren't designed for that. Our heads were not designed for that. So I think it's good to continue to improve helmets, and we need to go back to the drawing board, and really rethink what we're doing. So we did a study. 100 American football players, retired and active. We did this to basically prove that yes, football causes brain injury across the whole surface of the brain. And that's very appropriate. You guys are right on it. So we know pretty clearly that football damages adult NFL players' brains. But what about our kids? Are there studies being done? Well, there was. The Journal of Neurotrauma this past year did a fascinating study, fMRI, and they looked at 3 groups. The first group, they had diagnosed concussion, and on imaging, they showed changes associated with brain injury. The second group, no concussion. Their scans were also normal, made sense. But there's a third group that they had no signs or symptoms of concussion, yet cognitive testing and imaging showed that there were signs of brain damage. So there's brain injury going on when we don't know it. But how would we know unless we looked or assessed for this damage? So what do we do for these players? So now we assess them, 100 players having brain injury. We can't just leave them hanging, right? We have to do something. So performed a real-world study, and many of them were overweight, and they needed to eat a healthier diet. They needed to exercise. A lot of them had sleep apnea, so we gave them treatment, CPAP. We also gave them supplements that would help heal their brains. High-dose fish oil, as we talked about, vitamin B6, B12, and folic acid. Ginkgo and vinpocetine to increase blood flow. Huperzine A. Huperzine A increases acetylcholine. It's Chinese club moss. And huperzine A and acetylcholine help firing of neurons and communication. Now, huperzine A I wouldn't use acutely because you don't want to have excess firing of neurons when you're trying to heal from acute brain injury. But you do want to have activation for chronic brain injury. So that's why. What's that?
What's the starting dose?
Of huperzine A for chronic brain injury? Around 100 milligrams or micrograms, mcg. Yes, and so for example, there's been a couple of studies on nutrients after acute brain injury, such as high-dose magnesium and citicoline, which is another supplement that showed increased mortality, increased death rate after acute brain injury. So we have to be careful about what we're using acutely because we've got all these different processes. We've got inflammation, we've got excitation. You'll learn about glutamate from one of the doctors here tomorrow. So we have to quench those processes, but not excessively.
What is the efficacy of these herbs on somebody who's like 10 years into their brain injury?
Oh, I love the question. She asked, what is the efficacy of some of these treatments on someone who's 10 years in, 20 years in to a brain injury, multiple years? So most of these football players were retired NFL. So they had been out of the game for 5 or 10 years or longer. We've got all this evidence, supplements, nutrition, exercise. Let's see what happens. So 65 players had 80% improvement, especially in the area of focus, attention, mood, motivation. Was there applause? I don't want to stop that. Go ahead. Thank you. Yeah, I think it's amazing. Look, scans before and after. 12 years as a tight end. Yeah.
When you're doing the studies, there's level of players. There's players that get hit a lot because they're star players, and there's players that sit on the bench because
Yeah.
they're not star players.
Right.
There's 75 players on the team.
Mm-hmm.
When they're doing the studies, is this all of the players, or is it players that play a lot, or?
Well, we had players from all positions. So all positions, and
But they all play at practice.
they all
They're
get their,
playing in practice.
right. And these were professional football players, adults. And these are their exact, this is the same player's scan before and after. So we saw evidence of damage to their brain.
No matter what position or how
It really,
they play?
the players like this next one is of a linesman, for example. Those are the players that have the most head injury. So yes, position did matter, absolutely. Yeah, we saw worse damage in the linesman. They took more hits to the head. Yeah, it makes sense. So this is you can see comparatively. I'm not sure if I have a little laser, but I was just going to point out that you can see the very top. That's the frontal lobe. So with brain injury, it's the frontal lobe, the temporal lobe, and parietal lobe in particular. So right there, comparatively, and the temporal.
I'm sorry.
Yeah.
What was the average cost of the
I don't know the answer to that. That's a good question. Yeah, I don't think they had to pay to be in this study, the football players. No.
They're compensated.
I know
Yeah.
the National Football League put $765 million into a fund,
Right.
which is pocket change for them. but-
It's pocket change. It's something, but yeah, they need comprehensive health care coverage. Absolutely. Yes. Oh.
When you talk about the different positions and you talk about tight end, lineman, and so forth,
Mm-hmm.
you also look at like obstructive sleep disorders, obstructive sleep apnea, and the presence of that in linemen versus other positions.
Mm-hmm.
They tend to be heavier, they tend to be.
Right.
A
Yes.
little different. Is there any correlation?
Mm-hmm. Well, I think I understand. So the question is about what about other things that might be going on, like maybe they're obese or have sleep apnea. Could that affect their brain? Is that the question?
Yeah, specifically on the obstructive sleep apnea.
Yeah, I love it. So let me see here. I got two going now. So right here, this is typically where we would see, we call it a saddleback appearance. It looks like two little holes, more in the back, the parietal lobes, and that's often associated or correlated with sleep apnea. And so it looks different than brain injury, but we have to differentiate the two. We can pick up patterns associated with drug and alcohol use or other forms of toxicity. So the scan's very sensitive at picking up patterns of toxicity or decreased oxygenation, but it doesn't tell us what exactly it's from. So that's where we have to fit SPECT imaging into the clinical picture. We have to talk to people. We can't just look at the scan and say, oh, you've got this and that. It helps inform our practice and our judgment. So the saddleback appearance with sleep apnea is a little more clear than some of that, but we do see patterns of activity, and the same for depression, for ADD. We have over 100,000 brain scans in our database now. And we've been able to pick out what depression looks like, anxiety looks like, as it fits with the clinical picture for someone. So this was a linesman. His brain looks terrible, so it looks like there's missing a piece. And he's not really, this is decreased blood flow, but it looks awful. Frontal lobe, so I would expect to see impulse control, focusing problems, memory problems. So many of you know Zachary Lysted, local celebrity and hero. His mom, Mercedes, his father, Victor. And as I mentioned, the Zachary Lysted Law on sports and high school athletes. So we got to participate with Zach in a study of hyperbaric oxygen, another natural treatment for brain injury. Our portion of the study was to do before and after SPECT scans, 40 sessions of hyperbaric oxygen. So this is Zach's brain before and after. So you can see the frontal lobe did fill in right there, and the parietal lobe a little bit.
Will that digress, or do they have to continue those treatments?
I love the question. Is it going to worsen again, or is it going to continue to improve? Well, I think we'd have to do more studies. But how hyperbaric oxygen works is the idea is that the cells have been dazed from brain injury. They may not be fully dead, but they've been dazed and damaged. And that's why we can rehabilitate individuals with brain injury, is that we need to give those cells a boost. That's the idea with the nutrients. That's the idea with hyperbaric oxygen. So this chamber is a pressurized chamber breathing 100% oxygen for 40 hours over about 2 months. And under these conditions, there's so much oxygen that it pushes to the deeper structures of the brain and can allow for healing to take place. And it's kind of like when you plant a little seed. So if you just do a couple sessions of hyperbaric oxygen, it's not going to stick. But if you do 40 sessions, hopefully that seed has grown and has got roots, and so it'll stay. So typically after you've done enough sessions of hyperbaric oxygen, it sticks, and people continue.
Impregnating the cells with the oxygen.
Yes, these damaged cells finally have the opportunity, they're in an environment where they can heal.
And they use that for wound care too.
That's typically how it's hospitals will use it for stroke, ulcers that will not heal, because a stroke is also brain damage and lack of oxygen and nutrients will be infused. So, yeah.
What about IV ozone therapy?
What about IV ozone therapy? I think about ozone as, for infections and things like that. I don't know about, do you know about research on brain injury? Or just sort of thinking?
Ozone, but I know that ozone is also used for,
Mm-hmm.
systemic inflammation and
Ah,
wound healing.
yeah. Could be. I'll have to look into it. Question?
This is an oxygen 101 question. Antioxidants are good. Why is oxygen not that? Could you explain antioxidant and oxygen?
Okay. So oxygen is good, helps with healing, helps with energizing cells. And then antioxidants are more like for oxidation versus oxygen. Now oxygen, this is getting more in depth, but oxygen, how your body makes energy is it splits that oxygen molecule into two, which usually is quenched, but can become a free radical too. So, but it's usually not a problem. So oxygen is not really the problem. It's more the oxidative damage from inflammation from other sources. And so antioxidants tend to quench through electrical or chemical reactions the free radicals. Yeah. Other questions? So for Zachary, we noticed that he had, and his mom noticed, increased motivation. Now he's a pretty motivated guy already, right? He works very hard, does a lot of physical therapy. All of that stayed consistent through the study. But there were just some homework assignments and some things he didn't want to do, but he started doing those more, showed more initiation for things he didn't want to do. I think that's the key during this study. And again, this was a pilot study to look at safety and efficacy of hyperbaric oxygen in hopes of doing further studies. So some patients hyperbaric oxygen works, other patients it doesn't. Sometimes there's a minimum of 40 sessions. Often patients need 80 to 120 sessions to have healing take place.
Is that after one session or after a group of 40 sessions?
This is before and after 40 sessions. So 40 hours in that chamber. Yeah, so it was quite a commitment. You go in 5 days a week for 8 weeks, a lot of time. The other thing that we noted was that back here in the parietal lobe is also one of the things that's associated with is mathematics, and he did improve in cognitive testing on mathematics, which I thought was really interesting. So, how would we know unless we looked at the organ that we're treating? How would we know that some of these treatments are effective unless we looked? And how would we know unless we tried some of these natural treatments for brain injury? I think we need to go back to the drawing board and think about the multifaceted mechanism of brain injury, matching with the multifaceted mechanism of some of these natural treatments. But not to start over, but to build upon what's already been done. Thank you. Oh, there's time for more questions if anyone has more questions. Yes?
Might sound a little facetious. Experienced a high-speed motor vehicle accident 3 years ago. It's next to impossible to sleep. That's been blamed on anxiety. It's been pushed into more of the mental health aspect of these injuries. Have you done any studies to find out what part of the brain gets damaged so that sleep is next to impossible?
So the question is, what about brain injury and sleep or insomnia, right? Yeah. The thing is, with brain injury, it could have affected multiple areas, including your pituitary gland, which that's like the master gland and affects all of your hormones, So it's it'd be a whole nother talk on hormones and brain injury. Progesterone we touched on. Oftentimes for men, there's a lower testosterone, lower libido. excess cortisol, which is a stress hormone, and that can keep people up at night, for example, if you've got too much cortisol being released. After brain injury, it's, there's anxiety, there's increased activity in some parts of the brain and lowered activity in others. So absolutely, brain injury can be correlated with insomnia, and just have to figure out, which areas where you're having trouble. Any question?
Do you have any materials that you can order and read about that, or have you not explored that?
Yeah, I haven't explored that specifically. I'm interested to now, but we have materials on what we do, if you're interested. Yeah. Question?
What would be your primary recommendation for finding a local naturopath that's educated with regard to brain injury?
Oh, that's a good question.
Places to start.
Places to start. Well, the question is finding a good naturopathic doctor that can help with some of the basic things, at least, related to brain injury. And there's a couple around. Like in Seattle, I know of maybe one doctor, another two. And I think there's some in various places. You just have to go to, there's two websites I'd go to. Are you in Washington or Oregon?
Oregon.
So the Oregon Association of Naturopathic Physicians, they have a doctor search site, or the American Association of Naturopathic Physicians, and you can plug in brain injury as one of the search terms and see what pops up. That's what I'd go to one of those websites.
I'd also ask Sherry, the brain injury
Oh, yeah.
Alliance of Oregon, and if you're in Washington State, the resource line for the TBI is resource line of Washington State. We have 3,000, and we do have naturopaths. So I check with BIA Oregon, and then if you're in Washington, BIA Washington.
Yeah, good. Question?
How significant do you find injuries have to be before anything shows up on spec, like with a moderate concussion?
Mm-hmm.
Doesn't show up with MRI or these other.
Right. Even mild, the question is, how significant does the injury have to be before it'll show up on SPECT imaging? It goes back to the concept of brain reserve, how severe the injury has been. It's fairly sensitive at picking up brain injury. How sensitive, I'm not sure. But yeah, if you've had a concussion, even one concussion, it's worth checking. Why not check? That's,
How expensive is a spec test?
how expensive is SPECT imaging? So we do typically a full evaluation, which is 2 scans on 2 different days, because the brain looks different when you're concentrating versus when you're at rest, just meditating, relaxing. And so we'd like to have 2 scans to compare. And then the 3rd day, we do an evaluation. So you meet with the doctor. We have another doctor, so there's 2 of us in Bellevue. And we also do a thorough history, too, which is finding out all of the psychological and social and spiritual aspects. We put all that together for the full evaluation, which is $37.50, right, Saki? Yeah.
And you have the spec on site.
We have 2 cameras. Mm-hmm. Yep. And Dr. Amen is, the mothership's down in Costa Mesa, California. There's 6 clinics around Atlanta, Georgia, New York City, Virginia, San Francisco, and Bellevue. Yeah.
And how young can you do a spec?
I think the youngest is 5? 6.
We've scanned kids younger, but 6 is the recommended age.
Yeah, it's going to be tough.
You have to sit still for it, I presume.
Yeah, you have to hold very still for about 15 minutes. So it's not a long time, but kids get squirmy and it's hard. And the needle, we use a very small needle, but young kids, they've done it. We don't see a lot of that young kids, but